have this debate with my yogi friends about whether or not technology is good for us or bad, whether or not it takes us away from being present or actually enhances our ability to connect with people. And I think that's what we're seeing play out with a lot of the technology connection with biologics and the whole health environment. I think we're going to start to see whether or not technology can actually improve quality of life, but also our presence in the communities and the places we serve. Healthcare has been recalcitrant about accepting technology in making the business of healthcare work. We've got a lot of really good technology in helping people survive diseases and get well again, but we haven't really focused on how do we create a healthy human being and a better society. And I think that's the next step. It's inexorable. Technology will come to healthcare. It's here now, and I think we're going to start to see a lot of change, and I think it's going to only improve things and make things better for us. We have $800 billion a year of waste in the healthcare system. That's the Institutes of Medicine came up with that number. And if we solve that problem through technology and high touch, high tech, we will be able to pay back half the nation's debt over the next decade. So the driver of our economy is healthcare. The next $10 trillion of debt, 75% of it is Medicare and Medicaid. So unless we solve this problem, and technology is a part of that solution, we can't fix our economy, and that means bad things for everybody. It's a huge opportunity for us to export this connection between technology and creating a better way of life. And I think a lot of countries, and we're active in the Middle East and Qatar, in Tianjin in China, where they're actually looking beyond what we've created here to try and get in front of the issues that they know are going to affect their society. I actually think we'll have a better healthcare system up in the Middle East before we have it here in the United States. And I think that because we don't have the economic and political barriers in the Middle East or in China that we do here in the United States. And so the things that we're developing over there, where people want it, they're anxious to get it, they need to bring the middle class into a different kind of health status in those countries. They want to move past all the mistakes we've made in the West. And so we get to start new there with what looks good for the future, versus here in the United States, we've got to retrofit everything.